Welcome to Japan. Today, I'd like to talk about how to manage anaphylaxis. Let's begin by reviewing the emergency symptoms of a severe allergic reaction. After being stung by a bee, if your whole body turns red, or if the mucus covered areas, such as your eyes or lips, becomes swollen, they are warning signs. If you experience persistent sneezing, coughing, asthma attack, or difficulty breathing, stomach pain, diarrhea, or vomiting, this is an emergency. In some cases, you may even lose consciousness. Sometimes the body doesn't show redness, but the condition worsens rapidly, causing drop in blood pressure. The skin turns pale or bluish, weak pulse, loss of consciousness, or even cardiac arrest. If it starts happening, seek help and call an ambulance. If possible, lie down in a safe place. Low blood pressure might cause you to collapse. If you have an emergency allergy injection, use it as soon as possible. Don't wait for the ambulance to arrive. In some countries, there are other types, such as nasal sprays, but in Japan, the only option is EpiPen, injecting type. So today, I talk about EpiPen. EpiPen should be used if you experience the symptoms inside the red box. Respiratory or gastrointestinal symptoms, clouded consciousness or confusion, these people require injection treatment. When should someone consider keeping an EpiPen? Of course, anyone who has already had anaphylaxis, regardless of the trigger. Consult your doctor to determine whether you should have an EpiPen or not. Others include people who have been stung by bees before, or those who often go to places where they may encounter bees. A blood test can detect antibodies that cause an allergic reaction to bee venom. Even if you do not remember being stung, you may already have these antibodies. Please consult your doctor to discuss whether you need a prescription or not. However, if a large amount of venom enters the body, it can cause a severe inflammatory reaction anyway. So please remember, EpiPen is not all powerful. Prevention, avoiding stung is the most important thing. After receiving your prescription, make sure you have prepared to use it properly in an emergency situation. The shelf life of the medication is about a year. Regularly consult your doctor to ensure the medication is effective. The best outcome is that you never need to use it before it expires. Then replace it with a new effective one every year. However, proper storage is always important for in case. At home, store it where small children cannot reach. It can be very dangerous for them. However, it should still be easy for you to access quickly. Tell your family members or housemates where it is so they can help you in an emergency. Also, make sure not to forget when going out. Store it at 15 to 30 degrees. Do not refrigerate it, and do not leave it in hot places such as cars in summer or under direct sunlight. On hot days, you can carry it in your bag along with a cold drink. But do not cool it with ice because it may make it too cold. EpiPen is prescribed for the specific person based on their weight and age. So always use it. Use the injector prescribed for the person only. It should be administered by the person themselves or paramedics. However, parents, caregivers, or teachers may assist if necessary. And it's important to practice regularly. Once again, EpiPen is needed when symptoms in the red box appear: respiratory or gastrointestinal symptoms, confusion, or decreased consciousness. These require injection treatment. Now, let's look at how to use the EpiPen. The EpiPen comes in a transparent case. Once you remove the case, you see instruction printed directly on it. You can read them while using it. However, only Japanese is available, unfortunately. Important thing is the needle comes out from the orange tip. So do not hold it upside down. First, remove the blue safety cap by pulling it straight off. Hold the injector firmly with the orange tip pointing downward. Keep your thumb alongside your fingers as shown in the picture. Do not place your thumb on the end. Inject it into the middle of the outer thigh as shown in the picture. You can inject through clothing, but avoid thick or hard ones. Press the orange tip firmly against the thigh until you hear a click. Then hold it there for a few seconds before removing it. Even if your symptoms improves, go to the hospital as soon as possible. The medicine's effect is temporary. And then also bring the used EpiPen, in this case, to the hospital. There are also training devices without medicine available. Ask your doctor to practice with it, so you can act without hesitation, which is very important. Preparation is important. However, again, in medicine, there are no absolute guarantees. The best protection is not getting stung at all. A large amount of venom can cause severe inflammation anyway. So prevent stings, avoid perfume, use insect repellent spray, avoid black clothing, wear long sleeves and long pants. That's all for today. The season for enjoying the warm bath is coming. A relaxing bath is wonderful, isn't it? To make sure your reward bath doesn't become a trap for you. Next week, I'll talk about how to bath safely and then what to watch out for. I hope you all stay prepared, stay safe, and have a pleasant weekend. Thank you very much and have a nice day.